and it related to sort of social problems that weren't really amenable to engineering solutions. And that's sort of the background of where it came from. A couple of folks at MIT, if I remember right. Um, so they're wicked and they're hard to solve because they're really difficult to describe. They're really difficult to engineer. They're difficult to predict the outcomes, and they resist resolution despite repeated attempts. I think if you think about it, you'll find that there are problems like that in every society, and we have more than a few here. I've worked on issues around homelessness. We're starting to think about healthcare as a national issue. Of course, the COVID response is sort of a national problem we've been having, and it's a wicked problem, as are, say, I don't know, the U.S. elections, right? So we have a lot of very wicked problems that we're looking to solve. Um, and the issue here that's of interest in today's talk is trying to understand how to characterize and then try to move towards resolution. And the sort of the distinction that I'm making is that many of the older techniques that we've had, whether from design thinking or even systems thinking, are too simple in a lot of ways for understanding these complicated, complex, wicked problems. And so we're looking more towards sort of the other side of thinking in systems and thinking about systems. And a couple of examples there would be something from the 1970s, The Limits to Growth by Donella Meadows, or Donella Meadows' book that came out in near the turn of the century here in 2000, Thinking in Systems. Uh, these methods of thinking involve understanding complex adaptive systems and how parts relate to one another, and understanding that there are many moving parts simultaneously. So rather than trying to constrain a problem and shrink a problem down to its reductive elements, what we're really trying to do is open a space of problems and allow for multiple participants. So that's sort of a quick overview of the problem itself. Um, the context for today's work, just so we say a few words about it, we're not going to delve into adolescent mental health, but that's the context of the work. And so I wanted to contextualize it just a little bit. Um, the client or the foundation that we were working with actually was interested in the rise of adolescent mental health problems in the US over the last 10 plus years. And there's been really a significant increase. It's increased. Diagnosable mental health problems like anxiety and depression have increased by about 50% over the last decade, decade and a half. That's running at about 20% of adolescents are having some kind of diagnosable mental health problem. Uh, and it's actually been a stronger increase amongst the more affluent population in the US. Just by comparison, I looked up some statistics for India. Rather than 20% of the adolescent population having some diagnosable mental health problem, only about 6.5% of the population does. Um, it's actually decreased over the last 10 plus years, and the decrease has been stronger amongst the more affluent, defined by high and middle SDI. So it's a little bit the opposite, actually. And so I was a little concerned the problem may not resonate with most of the audience. And yet in the US, we are having sort of quite an issue here. Rates of anxiety, depression, and suicide have been increasing amongst adolescents for 10, 15 years. And it's been commensurate with the rise of smartphones, the rise of social media, and in the way it's actually used a lot in the US. So we talk a little bit about that, or I'll talk a little bit about that as we go. But for the most part, that's the context. And what I really wanted to talk about today was trying to understand, to use a method to talk about a method we're using called causal loop diagrams that can give us a sense of how big is the problem or how big is the space that we want to work in, and how can we involve a lot of people in the solution, right? And do that in a coordinated and reasonable way. So I'm going to dig in a little bit to this map, and there's a couple of links in the diagram. You can go online. This is all public. You can go online at headstreaminnovation.com where all of this is, and the link is there. And I'm sure that we can get that to you if you like. So there's three levels here, and I'm going to talk a little bit about something called causal loop diagrams, and say how to read them, and then we'll talk a little bit about some of the content here. So at this first level, what we did is we worked really hard to figure out, did we want to actually address anxiety, depression, and suicide specifically, or did we want to address sort of the positive side? Did we want to address well-being? And we chose to address well-being. in large part because we didn't have the skills, we didn't think, or the possibility of addressing the actual medical conditions, but we could try to address all of the issues that lead to those medical conditions. So that's the first thing we did. The second thing we did is we tried to identify what are the pieces that we could actually try to address with the resources that we had. And we identified these sort of circles here that are in different colors. So what we try to do in this entire map is to figure out how can we increase levels of self-esteem, belongingness, confidence, resilience, and ease with self and others. Um, the other ones that are contributors to anxiety and depression, like a genetic risk for depression in the upper right here, right? Or the level of childhood trauma, amount of sleep deprivation, all of those things actually do contribute to the level of anxiety and depression and contributes to suicide. But we can't really do very much about that. And we're certainly not going to start working back in early childhood. The way these lines actually read is that a solid line means the same as, and a dotted line means opposite. So let's say that we have, if the level of childhood trauma goes up, right, then the level of anxiety and depression goes up probabilistically, and that would suggest that the risk of suicide goes up again probabilistically. Right? Whereas if the level of confidence goes up, right, the level of anxiety and depression should go down, right? And then the level of anxiety, depression going down means the risk of suicide going down. So you can read the map in that way. And this is sort of the very high level saying that we're going to really try to concentrate on increasing these levels of what are called protective factors. They're psychological variables that actually help people be good, strong adults. And we want to reduce the level of anxiety and depression by affecting these protective factors. So that's the first step. Then the second step was to zero in on what we thought were what we and a bunch of experts I'll talk about in a moment, on what we thought were the key issues around developing those protective factors. And here, the notion that really came very strong for us was the notion of relationships, and I think this is something that will resonate with the audience, um, where the quality of relationships actually really matters, not only to us as Americans, but to us as human beings. We're social beings. That means something very specific. There are responses in your brain neurophysiologically when you're in a relationship. There are responses in your brain neurophysiologically when you're out of relationship. This is why breaking up is so hard, or the death of a loved one is so hard. The brain does actually feel pain, emotional pain, in the same brain centers as, say, physical pain. And so relationships are very important, and being able to manage them, being able to form them and extend them and maintain them and end them in appropriate ways is one of the markers of actually being a well-rounded adult citizen. So what we looked at then too is thinking about the in-person relationships. Let's look on the left here first, and then we'll talk about the online relationships for a moment. And I'm going to go through this pretty quickly, and then you'll see why in a moment. We're not going to have a chance to go through everything, but I really wanted you to get a sense of what we're trying to capture here. So the first is this in-person relationships, and the idea is that as the we can start anywhere, in fact. As the amount of time in person with your peers actually goes up, right, which is a good thing for all the protective factors. That's what all these colored lines are around the circle. As the amount of time in person with your peers goes up, then the variety of contexts in which those interactions occur increases, which is awesome. That increases the level of in-person belongingness, right? So people belonging to each other, feeling like they're a part of a group or a part of a friend group. That increases the level of pro-social. That increases the level of pro-social in-person experimentation. And this is crucial here because these are teenagers. Everybody's a teenager here in this diagram. And what they're doing is learning how to be adults. They're learning how to be social beings. And so this ability to experiment is really important, to be able to be in a group and make a little joke, and maybe the joke goes a little bit too far. And then somebody else says, hey man, you went a little bit too far, right? And they go, oh, I'm sorry. Or they say why, and they learn and they adjust, right? Most of us do. Some of us don't. We all know somebody who hasn't really learned those things, but most of us have actually learned those things. And the way we do that is by experimenting. That gives us proficiency in-person pro-social skills. That increases our level of experimentation and learning, and that cycle kind of carries on nicely. And that overall increases the quality of in-person peer relationships. It's the same thing for the online relationships. In fact, the circles are they're all the same except we replace in person with online. And to the extent that online relationships are positive and pro-social and not negative and bullying and those kinds of things, to the extent that they're pro-social, they actually can support the development of these protective factors. And we see that happening, right? So, and because the circles are so similar, and they do interact with one another. So the amount of time online with peers, for example, can actually cross over and increase the quality of in-person peer relationships. Right? What we do find is the circles are mostly the same, and so in the next map we actually collapse them. Right? And this is the final map, and I'm not going to go through all of this, so don't be too scared. But I did want to show that the relationship loop is here in the middle, right? And we retain that for the most part. But I wanted to highlight two other areas. One of them is over here on the left. Remember in the beginning, the context was adolescent mental health in the context of social media, in the context of being online. And what we did over here was sort of we thought really hard and we worked for a long time to figure out what is it that happens with social media online and how does it support or not support peer relationships. And one thing that the summary of this line here is that basically companies are businesses. They have a business model. They're designed to make a profit. So the decisions that they're going to make, the decisions they're going to make are decisions that are going to support their business. That's what they do. That's what many of our clients actually need them to do, because otherwise we don't have clients. So they make a profit and they make decisions to increase their profit. They're not trying to do anything one way or another. They're not trying to hurt teenagers. They're not necessarily trying to help them. They're just trying to make a profit. And it's basically an advertising based model. So every time they make a decision to make more money, right? There are some times where that's supportive of relationship formation. There are some times where it's not. There are some times where it actually sort of breaks apart the notion of relationship. And that's kind of what happens here. So that as the amount of time and the decisions that are made in the business actually start to increase, the amount of time for online social engagement goes up. That's been their plan all along, which is fine, right? It also increases the probability that there's going to be perception skewing content, right? You're going to see different things about body image or different things about how wealthy people are, or different things that starts to skew content that is viewed, and people don't know how to put that into perspective. And then that starts to increase things like social distance from expectations. There's a level of risk of making errors in judgments. People are exposed to sort of acute traumatic effects like bullying or humiliating situations, or they make those little experimental mistakes where they send maybe a photo they really shouldn't send, but now it's online forever. How do you recover from that? So all of these sort of darker colors over here are kind of the dark side of what happens on social media. Um, the loops are here. You can see them. The quality of risky peer relationships, the probability of that goes up. The probability of adverse online events goes up, right? The probability of deviation from pro-social relationships goes up, right? Um, and the amount of unresolved online harm can go up, which would lower all of these protective factors. Oh, keep hitting the mouse wrap, sorry. The one other thing that I would point out here is that the quality of an adult or other trusted adult relationships influences very strongly the overall mental health of an adolescent. And you can see that happening here, where having just a really strong parent or strong adult, only one, you only need one, right, can increase the level of belongingness, can increase your proficiency for skills, can decrease the amount of unresolved harm, can decrease the amount of time with risky peers. And all of this reduces the probability of harm from being online or having social media, or just of having non-pro-social relationships, harmful relationships. So that's basically the content there. What I wanted to talk about now is just a little bit of like, what did it take to do that? If we're going to try to capture all of this into one slide, which admittedly we move pretty quickly through, but I think you can catch the idea of it's a lot of stuff in a relatively small slide. Um, it requires actually having a really fair amount of knowledge of the overall system, right? You have to be able to have read through the literature, which we did. We spent a lot amount of time reading through both the academic literature, the popular literature. We spoke with a lot of experts, a lot of psychologists, a lot of practitioners, a lot of people who are trying to run businesses in this space. And we put all of this together into this map, but then we went back to those people and had it adjusted again and again and again. So in a way, it was a little bit of a crowdsourcing activity, to where we got to a place where the map was reflective of what it was that we all wanted to work on. So no map is perfect, right? But what we really strive for is to see if some of them are actually useful. And so that's what we were striving for, was utility. Building that map is not only a matter of taking the pieces out of the literature and putting them together. It does require some judgment and some synthesis, right? At the time we did this, people hadn't been talking too much about the business model issue in that particular way, for example, or relating parents and risky peer group relationships, for example, together in that particular way. And it is overall a communal activity. The benefit of doing this work, though, is exceeds beyond just the characterization of the problem, right? Because if we had my little sharing picture down here, it sets the context. This is the work we're doing together, and this is what we're not doing, right? Anything that's not in this map is not what we're doing. Anything that is in this fair game. So it's a pretty big space. It also communicates pretty quickly to a pretty wide group of people that this is the context. This is what we're doing, right? Um, it allows us to convene individuals and organizations to come together to work and to work systematically, right? Anybody who has any program, who wants to do something in this space, whether it's an entrepreneur or an organization or whatever, right, can know where in the map their program is going to have impact, and it helps everybody to focus and helps everybody to know how everybody else is actually working. And it gives us a sense of what is your intended impact. Um, Oh, there. So what we've done since then is something called Headstream. There's some links down there. With Second Muse has been running this. We do have an accelerator. We're running another one now. There's an innovation program for youth to actually start running groups. There's fellowships for youth, and there's ongoing research. This involves, there's thousands of people involved in this now. Actually, within the network, there are many people that are actually running businesses that we've been able to fund because of our funder. We're running a second round of this, and we're actually doing a different kind of map, another one to really bring in large corporations to start looking at this and say, hey, maybe we should be thinking differently about how we do this. The entire map is organized around relationships. The entire efforts are organized around relationships, protective factors, and non-advertising business models, trying to bring that into the mix. And I think that's it. I think my time might actually be a little bit up. I want to thank you for your attention. I hope it worked out on your end as well. Do feel free to visit those sites. And if you have any follow-up questions after this, do feel free to send me an email. That's totally okay. So thank you. Maybe I should do that. I don't know what I'm supposed to be doing at the moment.
Excuse me, sir.
Hello?
Yeah, you're not able to share the content.
Oh, I can share it again. I don't have any questions or anything.
Just give me 1 minute. I'll put up the
Okay.
questions in the chat box.
Okay. Okay, I have a question. I think that's a great question. We are working very little with existing social media companies. What we find is that the existing social media companies, like any other companies, have a business model, and they have to support that business model. So, and they're going to continue doing that. They will only be hemmed in, right, by either regulation or by people just sort of voting with their feet and going somewhere else. So what we're trying to do is to start on the other side and say, how can we start creating companies that push the system over towards something that is more amenable, that's maybe not an advertising model. The we don't I don't I will speak for myself. I don't personally think that the map itself is going to course correct business as usual, because I don't think that there's really any incentive for them to do that. So what we're trying to do is to create an entirely new ecosystem and slowly transform one to another. That is what we think is, or at least what I think is, what strategy is about, is creating transformational ecosystems. It's very hard to change existing businesses just because of their, between the shares market and their own business models and the investments they've had. I think all the business literature says that's very hard to do. Interesting. Does this adolescent mental health? So adolescent mental health, if they have problems, whether anxiety, depression, it does affect their engagement in online school learning. And in fact, online school learning is very difficult for young people. We think, in for many young people, not for all, but for many, because they're not able to actually be with their friends and to interact and to sort of learn how to be social beings. So the possibility that it can actually there can be more adverse effects with online school learning, especially during this pandemic, um, and because it's happened so quickly, there are clearly folks that are doing fine. People who have been homeschooling, for example, in the U.S., taking their kids out of the formal school systems and teaching them at home. There are people who have been doing that for quite a while, but they've had a lot of training and a lot of time to get used to that and to do it. Most people haven't. So yeah, we think that it actually does. In fact, I think anyway that it has, and the evidence seems to be suggesting that it's been the pandemic has been particularly hard on women and on kids. So yeah, all right. Uh, yeah, that's it. I'm good. Thank you very much.
Thank you so much, sir. Thank you for making the conversation so interesting. Thank you to all attendees for joining in. Thank you.
Thank you.